This is Group 10's presentation on the opioid crisis.
The opioid crisis has become a growing epidemic in the U.S. As one of the growing categories of substances that are being abused, it has caused a crackdown on the prescription of these painkillers as a greater number of people become hooked on the drug. While it is used medically for pain relief, opioid use disorder usually involves misuse of prescription opioid medicines or illicitly obtained drugs such as heroin and fentanyl. OUD is typically a chronic and relapsing illness.
In the past 2 decades, we have seen a dramatic rise in opioid overdose-related deaths. In 2016 alone, the U.S. lost 42,000 lives to opioid overdose. However, overdose is not the only risk to this crisis. As opioids were prescribed by professionals as forms of painkillers, dependency was almost a given consequence. Further risks include not only addiction but also possible sharing of illnesses passed through contaminated needles. The shift from opioid abuse via painkiller to heroin to synthetics contextualized the growing severity of such abuses of the substance. Specifically, 8 states, as marked blue, had opioid-related mortality rates that were almost doubling every 3 years, and the 3 red pins, which include our very own capital city, D.C., have mortality rates that double every 2 years. Trends of opioid abuse and overdose strangely highlight more high-income parts of the northeastern United States, making the case of this epidemic more unique than most cases of substance abuse-related mortality rates, both domestically and internationally.
According to the U.S. Department of Health and Human Services, there are many programs and campaigns in effort to combat the opioid crisis. These help to bring awareness about substance use disorders and the misuse of opioids. States across the country have established prescription drug monitoring programs in response to the mortalities due to drug use. Stanford researchers developed an intervention program to prevent new cases of opioid use disorders among U.S. adults for 11 policy responses to the opioid epidemic. For policies, legislation has limited opioid prescriptions by setting a supply limit, which has been passed in several states. Those who have a history of opioid use disorder are a high-risk population for screening, and there are many locations to get screenings, like the emergency room, primary care physicians, pain clinics, and more. There are many ways for a patient to seek treatment. Medication-assisted treatment is a combination of medications, counseling, and behavioral therapy. There are 3 commonly used medications in order to combat addiction. There are many resources to get assistance and find the right treatment.
We think that the measures taken up to this point in time are helping to address the problem. However, there is still a growing number of people becoming hooked to the drug, both the prescription and illicit drug heroin. However, since this is a relatively young problem, it is not surprising that there are still problems revolving cracking down on the crisis. Perhaps with more time and research, to enforce stronger laws and develop better programs on how to deal with the epidemic, the measures taken up to that point will alleviate the problem. New research is being mandated for all current and future opioids, namely the ones that are used for long-term control of pain, on whether or not opioids actually help with the control of pain or if they have a declining effect on patients long-term. A second study is also being required on the link between opioid use and hyperalgesia, a condition that causes an increased sensitivity to pain.
Information about the opioid crisis is available to the public through institutes such as the National Institute on Drug Abuse, Center for Disease Control and Prevention, and the U.S. Department of Health and Human Services. Someone can access this information by simply searching for it on the internet. People can go to the Substance Abuse and Mental Health Services Administration or the U.S. Department of Health and Human Services website that show the locations for the treatment programs throughout the country. People can also go to support groups for drug addiction and attend intensive individual counseling while receiving treatment. There are misconceptions surrounding this topic. According to Yale Medicine, there are 2 major misconceptions. The first misconception is that opioid addiction is just a psychological disorder and people who are dependent simply need better willpower. The second misconception is that the best way to combat an opioid addiction is without medication. The way these misconceptions can be dealt with is by raising more awareness and understanding why they are misunderstood and not true to the crisis.